Hello there. Now, life is valuable and precious, and being able in reviving someone's heart to save their life will provide us immense satisfaction. It's sad but a true fact that the number of people dying from cardiovascular diseases is steadily rising in India. Most of these cardiac deaths are sudden and on spot. It is in fact possible to prevent these sudden cardiac deaths if the affected receive immediate medical attention and CPR. The recent incidences of some celebrities collapsing suddenly and passing away due to a heart attack are eye-opening and shocking. There's an alarming rise in the number of young patients with heart attacks and sudden cardiac arrest. What is equally scary is that sudden cardiac death may happen in people who have no known heart disease. The risk is higher for patients with existing heart disease. In almost every family, we have at least one family member with a heart disease. What if you can save a life in some way in an emergency situation? Yes, it is possible if you are well trained in CPR. Many adults in cardiac arrest can be revived with intact neurological function if the bystanders provide immediate CPR. Raising public awareness and understanding of the practical application of CPR is an essential strategy to increase CPR success in cardiac arrest cases. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today, we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. Dr. R. Ravindran, consultant cardiologist, Rays Clinic, Chennai. Dr. M. Hanumanta Reddy, consultant interventional cardiologist, Care Hospitals, Hyderabad. Dr. Muthaiya Subramaniam, cardiologist and electrophysiologist with the Wellbe Heart Foundation, Coimbatore AIG Hospitals, Hyderabad. Let's get straight into the discussion now. Young people of about 30 to 40 years of age are having heart attacks and serious heart problems. What is the main cause of the steep increase in heart problems among youngsters? Dr. M. Hanumanta Reddy?
Mostly in youngsters, these common causes of an heart attack when compared to an elderly, what we are seeing in recent trends. Previously, heart attack used to get in elderly above 60 years, but nowadays the trend has changed to an younger patients. The common cause of an heart attack will be in smoking, associated tobacco chewing in these patients, and most common will be young onset with diabetes and hypertension and associated these drug addicts. Most important thing is that doing a workout which are not properly instructed by any gym instructors. And most important thing is nowadays when sedentary lifestyle and the junk food increased, and most important thing is lack of sleep. One more thing is the young patients. Recently there is a increase in a COVID infections which was even lead to a blood clotting disorders which has caused an increase in heart attack and lung attacks.
All right. Now, how high blood cholesterol is the major cause of heart disease? Does cholesterol accumulation start from a young age, or does it start accumulating only due to a poor lifestyle later on in life? Dr. R. Ravindran?
We all know that the cholesterol is the main reason for the blood vessel occlusions. There are two types of blood cholesterols. One is a bad cholesterol and another one is a good cholesterol. See, the bad cholesterol is an LDL and triglycerides, and then good cholesterol is an HDL. See, when the starting of the blood vessel occlusion starts from very younger age group, like from the childhood and even from the school age groups, that initially starts as a fatty streak in their blood vessel. But the progression of that fatty streak to the complete occlusion of their blood vessel and causing a heart attack is definitely caused by their poor lifestyle, as lack of sleep, lack of exercise, and eating a not balanced diet. All these things will lead to the complete occlusion of their blood vessel and lead to the heart attack in their age.
Okay. You know what, it's a shock when you hear that an apparently healthy person had a cardiac arrest. What could be the likely reasons for such an incident, and what should we understand or learn from this? Dr. Muthayar Subramaniam?
Yeah, that's a great question. We often find it disturbing when we see that completely healthy people have had a cardiac arrest. And I think the cause of a cardiac arrest, it sort of depends on how old the patient is. Really, if you look at the heart, there are really three different parts, and that's what I usually tell the patients, that one is the muscle, one are the arteries that supply blood to this muscle, and then there is an electrical system that sort of coordinates all of these things together. So usually in elderly people or people more than 40 years, when they have a cardiac arrest, it's usually because of these blood flow in these arteries, and this often leads to a heart attack, and this can present as a cardiac arrest. But we see younger and younger people, like my colleague said, and these people, the problem is often a genetic problem that they have in their muscle or a genetic problem that they've inherited in these electrical system of their heart. So these are the sort of things we look at when we see a person with cardiac arrest. And the three real significant triggers for these are a significant family history. If you've had another family member who's had a cardiac arrest, rigorous exercise sometimes can precipitate these events, and uncontrolled hypertension and smoking. So these are some things to keep in mind. And if you have any of these risk factors, it's probably better to get a cardiac screening at even before the age of 30 or 35.
Now, is chest pain always an indicator of a heart attack or a heart disease, Dr. M. Hanumantha Reddy?
Very great question. Most important thing is always any chest pain, if it is associated with sweating and left hand pain and severe giddiness and patient there is decrease in the BP, always you need to worry. But it does not mean that every chest pain you need to worry. There are some criteria which you need to know how the chest pain should be differentiated. If any chest pain who has a severe associated with any acidity, burping sensation, you need to think that it is relieved by some antacids, by taking any pantoprazole tablet. Most of the times it is related to an acidity problem. Some of the patients will also be having chest pain. Most of the time it will be associated with cough or cold. When the pain is increased on breathing, so some lung infection is there, that time it is named to be a pneumonia which has caused the chest pain. Some of the times the chest pain can be even due to any injury over to the ribs or to bones associated over the lung which can cause the chest pain. But any chest pain which is a severe squeezing type and it is radiating to your hands or the both hands to the jaws associated with severe sweating and shortness of breath, always you need to consult a local doctor. Preferably take an ECG, and even if it is normal, observe for 6 to 12 hours. If it is normal, then you need not to worry. If there are any variations in ECG, please consult a local cardiologist, then further test can be done. Always don't neglect any chest pain which is bothering you. Please get a checkup done.
All right. Now, what steps should a bystander do if he or she recognizes that someone is having a cardiac arrest? Dr. R. Ravindran.
That's a very important question, and where everyone should know about what is a cardiac arrest. First, when someone nearby us suddenly fell down or become unconscious, first we need to make sure that it is an unresponsive cardiac arrest. How we have to make the confirmation of that is just go nearby them, tap them, or just ask them, are you okay? Or just observe their chest wall movement for the normal movement of the breathing, and just palpate their pulse near the neck. Is called as a carotid pulse. Just ask for palpate the carotid pulse is present or not. Then, if you confirm the patient is unresponsiveness, there was no pulse and there was no proper breathing movement, then activate the nearby medical emergency team, as call 108 or call the nearby ambulance or something. Then you start doing the CPR. The very important things about CPR means the cardiopulmonary resuscitation. You have to remember the word CAP. C stands for chest compression, A stands for an airway, and B for an breathing. See, among these, the chest compression is very important. You have to keep your hand like this and lower part of the chest and start giving the chest compression. At the time of giving a chest compression, your elbows should be straight, and the chest compression is very important in the way that it should be given properly as a 5 centimeter depth and 100 to 120 chest compression per minute. In between the 100 to 120 chest compression, for every 30 chest compression, you have to give 2 artificial breathing like mouth to mouth or artificial breathing should be done. This is very important. Everyone should know to save when nearby was collapsing to a cardiac arrest.
Now, what are the current guidelines for administering CPR in India, Dr. Muthaiya Subramaniam?
So yeah, thank you for this question. I mean, there have been various guidelines in CPR that have been discussed. Multiple societies, multiple organizations sort of have their own take on what the CPR protocol should be. So unfortunately, we don't have a gold standard universal CPR guideline that we use. A lot of this data comes from Western countries, and the main limitation is that we don't have automatic defibrillators that are probably more available in the West. And those are machines where you can deliver a shock to restore your cardiac rhythm. So in terms of the basic life support sort of CPR that I think Dr. Ravindran was mentioning, I think the few important points are absolutely identification that the patient requires CPR and a good CPR technique. And CPR technique is not something that you need to have some kind of practice, or you should have seen someone or learnt it somewhere before you try to administer the CPR. And I think that an effective CPR is important. And the more importantly, if you see someone else giving CPR, you need to pitch in and help. Because CPR, I think everyone would agree, it becomes quite exhausting for the person who's delivering CPR as well. So you need to pitch in and help, and it's often 2-3 people together who can deliver an effective CPR for maybe 10 to 15 minutes before help arrives.
All right. On that note, we'll take a very quick break, but we'll be back with more on this discussion. Welcome back. Now, let's get it straight with the questions there. How essential is it that people who have a family member with a heart disease learn CPR? Dr. M. Hanumanta Reddy?
Very good. Any patient, if they're suffering from a heart attack and heart diseases, their family member should be aware of a CPR. Not even for the family member, any who has an elderly, when given a CPR, they should be always be trained. It can be in the schools, colleges, or the bus stand, whatever may be there, they need to be learned to give a basic CPR. Basic CPR is when a patient is unresponsive, or the person over the road where you are going is an unresponsive. First, you need to tap the person and see whether it's responding, or if not, if you are trained in a CPR, you need to give an adequately CPR, compressing the chest and at the same time giving a ventilation at a breath of 30:2. Means for 1 minute you will be compressing at least 100 times the chest, and at the same time you will be giving it 30 times 2 times of breath. Most important thing is the basic life support. What you give that time is most important for the next few minutes for the patient to survive until he reaches to a tertiary care center or an hospital where the advanced cardiac life support is there. The initiative by USV and NDT is very good to make a learn CPR for an every patient, even to an every person all over the country, so that they can give an adequate life support. Nowadays, we are seeing many patients are dying of a sudden cardiac arrest. Once you are trained for giving a CPR, most important thing is associated with it, how to handle automatic defibrillators. Most of the times it is located in an airport, bus stands, nowadays in a malls. You should be able whether how it needs to be connected, whether the rhythm can be shockable or an unshockable. If it is shockable, you need to give a shock. If not, then you can go and compress in the chest at the same time giving a ventilation until an adequate ACLS care takes off. The initiatives taken place in an hospital where the patient relatives are trained in our hospital by giving an educative training and even in a manicure training. Even it can be done in a groups to a college students or in a graduates to an other than medical fraternity to train for a country, and we can save further lives. Very good.
Well, though your intentions are correct, wrong or half knowledge can be dangerous. When should you not perform CPR, Dr. R. Ravindran?
The thing, good question, ma'am. We have to understand and identify who needs the CPR first. The unresponsiveness entirely different from a cardiac arrest. Just if the patient go and see whether the patient is just become unresponsiveness, but their heart is still beating, you are able to palpate the pulse, but he is only not responding, then those patients does not need any CPR. See, if they are become really a cardiac arrest, there was no pulse or no heartbeat, and there was no breathing pattern, then you start CPR. And as I already mentioned, the proper CPR is very important, as it is going to save the patient's survivability from twice and thrice from the cardiac arrest. So the proper CPR is must and chest compression is 100 to 120 per minute. As we are repeatedly telling this number of 100 and 120 is because it is such a very important, because just giving a mild compression over their chest like 1 to 2 centimeter will not going to help the patient, and giving only 20 or 30 compression per minute is also not going to save the patient. So properly giving a 5 centimeter tip and 100 to 120 per minute chest compression, because it's going to maintain the cardiac pumping mechanism till the patient's own heart is going to pump and circulate the blood. So as it is very important step, we have to give the CPR in a proper way to save the patients instead of giving an improper or with an off knowledge.
And what precautions should existing heart patients take while traveling, for instance, Dr. Muthaiya Subramaniam?
Yeah, I think this is really important because we see a lot of people who want to travel, either short-term travel or long-term travel. And I think especially if you're planning a long-term travel, more than 2 weeks, it's probably better to meet your physician or cardiologist once before you do travel. A few things that I think are important that sometimes people neglect is you need to take your medications. You need to take especially your prescription, because sometimes you'll find different medications where you travel. And if you're traveling to an area of a higher altitude, you need to be quite careful, because the air is thinner in these areas. You will have a harder time to breathe. Even normal people have a harder time to breathe in these higher altitudes. So maybe not all patients with cardiac disease I would recommend to travel to a higher altitude. So you probably need to get an okay before you do that travel. And on the opposite end, when you travel to a tropical place, humidity is going to be high. You need to especially watch out for your hydration and sort of make sure you're drinking enough water also. And I think with the anxiety of travel, especially if you have hypertension, to make sure that you take your medications before you travel and during your travel as well. So just a few things that I probably think are important.
All right. Now, is a silent heart attack the same as cardiac arrest, Dr. M. Hanumanta Reddy?
No, the two needs to be differentiated. Sudden cardiac arrest is a thing where the patient has collapsed, there is no pulse or BP, and this patient, if he has not given adequate treatment, he is going to die. The silent heart attack only says that patient had an heart attack previously where the patient was not able to perceive his symptoms, sweating, chest pain, breathing difficulty, or maybe even perceive the symptoms. He was thinking it may be due to an acidity or another causes where he was not approached in a doctor. Later, when he came for any further purposes or to an hospital for any planning for surgery or due to another things, when ECG or an echo was done, where we are able to see that there is some changes in the ECG or an echocardiogram, where already some heart attack has occurred, where then will tell to the patient that already there was an attack has occurred, but you were not aware. Most of the time, the silent heart attacks are known to occur in diabetic patients, where even the chest pain, the typical symptom, they may not able to pursue, just a mild breathing difficulty which may leave it, or which they may think an acidity problem, just they will suffer. So any patient who had some atypical pain, even mostly in diabetic, associated with sweating and breathing difficulty, always you need to consult your doctor and take an ECG. Both should be differentiated, ma'am. Thank you.
When experiencing a heart attack or heart attack symptoms, should one take any medication, Dr. R. Ravindran?
Ma'am, just first we have to understand that whether the patient is having already a heart patient or first time they are experiencing the heart attack symptoms. If the patients already have an heart attack and again is experiencing the same symptom, they will know the tablet name, the sorbitrate. They have to take it in a chewable or in a spray, buccal spray, they will be available. See, the first time if the patient is experiencing the heart attack like symptom, as Sir already mentioned about, and typically chest pain with sweating, with radiating pain, then the patient is advised first to go to the nearby hospital, but don't drive or go alone, take someone's help. If the heart attack is confirmed, I need everyone should know about these three drugs, which is a blood thinner, aspirin, clopidogrel, and statin, atorvastatin 80 mg. This is something called as a loading dose. When patient has been confirmed with an heart attack, we have to give this loading dose as early as possible, like within 30 minutes or even before that if the heart attack has been confirmed. Why it is such an important is, if you give these three medications, once the heart attack is confirmed, the chance of survival of the patients from 100% occlusion to opening of that artery is 21%. So even before the patient reaches the hospital, if you take this medication, which is called as a loading dose, it's going to be a life-saving for that patient. So I need everyone should know about this loading dose drug and keep this drug inside their own room and then house if they are suspecting our father, mother, both are having a heart problem or heart attack. I think we need to know about this drug and keep it as our life-saving drug.
All right. With that, I'll thank all the three doctors who are joining us here. Many thanks. With that, we're taking a very quick break.